Hi dentist, it's P square. Let's learn pathology topic cell injury. This is very important topic because sometime a 10-mark question comes on this. Cell injury is defined as functional and morphological effects of variety of stresses due to etiologic agents a cell encounters resulting in change in its internal and external environment. This is the best flowchart to understand cell injury. कीमिया और हाइपोक्सिया के कारण सेल के पास सफिशिएंट ऑक्सीजन नहीं होती, जिस कारण एटीपी सिंथेसिस डिक्रीज हो जाती है, जिस कारण कैल्शियम आयन की कंसंट्रेशन इन द साइटोसोल इंक्रीजेज. ड्यू टू रीपरफ्यूजन द माइटोकॉन्ड्रियल कंसंट्रेशन ऑफ कैल्शियम आल्सो इंक्रीजेज. द कंसंट्रेशन ऑफ कैल्शियम इन साइटोसोल विच इंक्रीज रिजल्ट इन फोस्फोलाइपेज एक्टिवेशन एंड प्रोटीएज एक्टिवेशन. प्रोटीएज एक्टिवेशन के कारण साइटोस्केलेटल इंजरी होती है विच रिजल्ट इन डैमेज ऑफ सेल मेम्ब्रेन. Phospholipase activation result in lipid breakdown products of cell membrane and there is increased loss of membrane phospholipids which is also due to decreased synthesis of cell membrane phospholipid which result in cell membrane damage. There is formation of toxic oxygen radical due to decreased ATP generation such as superoxide, hydrogen peroxide and hydrylines which result in lipid peroxidation DNA damage which ultimately result into cell membrane damage and cell death. Due to cell membrane damage, there will be liberation of intracellular enzyme which cause nuclear changes such as pycosis, karyolysis and karyorehosis, and there is cell death and formation of myelin figures. There will be increase in the serum enzyme estimations such as SGOT, LTD, CPK, MB, etc. Usually a question comes as write etiology of cell injury and explain pathology of reversible and irreversible cell injury. Etiology of cell injury: cells may be broadly injured by two major groups of causes, genetic causes and acquired causes. Acquired causes are again of 10 types. They are hypoxia and ischemia, physical agents, chemical agents and drugs, microbial agents, immunological agents, nutritional derangements, aging, psychological diseases, iatrogenic factors and idiopathic diseases. Let's discuss the etiology briefly. Genetic causes. The genetic disorders account for 10 per 1000 population globally. Hereditary means derived from parents and congenital means born with. The teratogens may result in intrauterine death, intrauterine growth retardation, functional defects and malformations. Classification. Agenesis means complete absence of an organ. For example, unilateral or bilateral agenesis of kidney. Aplasia is absence or development of an organ with presence of ruminants. Example is aplasia of lung with rudimentary bronchus. Hypoplasia is incomplete development of an organ not reaching to the normal adult size. Like microglossia means small tongue. Atresia refers to incomplete formation of lumen in hollow viscera. Developmental dysplasia is defective development of cells and tissues resulting in abnormal histologic structure. Example is renal dysplasia. Dysraphic abnormalities are defects resulting from failure of fusion. Atopic or heterotropic refers to abnormal location of tissue at atopic sites like pancreatic heterotrophy in walls of stomach. Numerical abnormalities. Polyploidy is the term used for number of chromosomes which is multiple of haploid number. Aneuploidy is the number of chromosomes which is not an exact multiple of haploid numbers, like hypodiploid which is 2n-1 that is 45 chromosome. Monosomy. Hyperdiploid that is 2n+1 which is 47 chromosome that is trisomy. Syndrome is trisomy of 21 chromosome. In about 95% cases of Down syndrome, it is due to non-disjunction during meiosis in one of the parents. It is most common chromosomal disorder and it is the commonest cause of mental retardation. Incidences of producing offspring with it rises in mothers above 35 years of age. Klinefelter syndrome. It is the most important example of sex chromosomal trisomy. In about 80% cases, the chromosome number is 47, that is XXY, and typically these patients have testicular dysgenesis. In general, sex chromosome trisomies are more common than trisomies of autosomes. Turner syndrome. It is monosomy, that is 45 chromosome, means XO. Mostly it is due to loss of X chromosome in paternal meiosis. The characteristics are short stature, vivid neck, shield chest, underdevelopment of breast and widely spread nipples, rudimentary ovaries and nevi. The two major causes of cell injury. The second one is acquired causes, hypoxia and ischemia. Most common mechanism of hypoxia cell injury is due to reduced supply of blood to the cells due to interruption, that is ischemia. Hypoxia may also result from impaired blood supply caused by other interruptions like disorders of oxygen carrying RBCs, like in case of anemia, carbon dioxide poisoning, heart diseases, lung diseases, and increased demand of the tissue in some of the activities. Physical agents are mechanical trauma like roadside accident, thermal injuries like by heat or cold, electricity, radiation, for example by ultraviolet or ionizing radiation, and by rapid changes in atmosphere pressure. Chemicals and drugs. Chemical poisons such as cyanide, arsenic and mercury, strong acids and alkalis, environmental pollutants, insecticides and pesticides, oxygen at higher concentrations, hypertonic glucose and salts, social agents such as alcohol and narcotic drugs. Microbial agents include infection causing microbes such as bacteria, viruses, fungi, protozoans, etc. Immunological agents. Immunity is called as double-edged sword. It is very interesting because the immunity protects the host against various infections, but sometimes it may turn into lethal and cause cell injury such as hypersensitivity reactions, anaphylactic reactions and autoimmune diseases. Nutritional derangement can be a cause due to overall deficiency of nutrients like starvation or protein calorie malnutrition, for example melasmus kwashiorkor, mineral deficiencies resulting in anemia, etc. Nutritional excess is also harmful such as obesity, atherosclerosis, heart diseases and hypertension. Cellular aging leads to impaired ability of cell to undergo replication and repair, which ultimately result into cell death. Psychological diseases are due to mental stresses, strains, anxiety, overwork and frustration such as depression. Iatrogenic causes are owing to the physician, means they are physician induced, which occur due to error in the judgment by the physician and untoward effect of administered drug. Idiopathic diseases are of unknown cause. For example, 90% of the cases of hypertension are idiopathic. Injury is of two types, that is reversible and irreversible cell injury. Reversible cell injury if ischemia or hypoxia is of short duration and the effects are reversible on rapid restoration of the circulation. Pathologic event of reversible cell injury: decreased generation of cellular ATP, that is due to ischemia because of interruption of the oxygen supply by the blood, or by hypoxia because of the other causes. There is intracellular lactic acidosis, which is because the oxygen is not available for the generation of ATP. Therefore, there is other cycle induced in the cell to form some energy sources and that result into acid formation, that is lactic acid, which is called as lactic acidosis, which result in nuclear clumping. Damage to plasma membrane pumps, which result in hydropic swelling and other membrane changes. There is reduction of protein synthesis because of the swelling of the cell and internal organs. The ribosomes get dispersed. Let's discuss about various organ changes. In mitochondria, there is swelling and amorphous density. In membranes, there is cell swelling, wells and myelin figures. Along with this, there is intramembranous particles. There is swelling of rough endoplasmic reticulum, and due to this, the ribosome get dispersed. There is presence of autophages, and the cytoskeleton is aggregated. Nucleus show clumped chromatin. Irreversible cell injury. When ischemia or hypoxia persists for long duration, the cell undergo irreversible damage to the structure and the function and ultimately lead to cell death. There is no clear-cut differentiation or the point from which the reversible cell injury get converted into irreversible cell injury, but the sequence of event is continued of reversible cell injury. There is calcium influx which result in mitochondrial damage. Activated phospholipases cause cell membrane damage. It is most important event in irreversible cell injury. Intracellular proteases cause cytoskeletal damage. Due to higher concentration of calcium in the cytosol, there is activation of endonucleases which cause nuclear damage as pycosis, which is condensation and clumping of nucleus, and karyorehasis. There is nuclear fragmentations into small beads that disperse into the cytosol, and karyolysis, it is dissolution of the nucleus. Lysosomal membrane get damaged and that result in escape of lysosomal hydrolytic enzymes that cause cell death and phagocytosis. Mitochondria is swollen with vacuoles and have large densities. Cell membrane shows myelin figures and it is disrupted. There is lysis of endoplasmic reticulum and the rough endoplasmic reticulum shows disrupted ribosomes. The lysosomes are swollen and ruptured. Cytoskeleton is disrupted and nucleus show particular changes that are pycosis followed by karyorehasis and ultimately karyolysis. This picture shows the mechanism of cell death by hydroxyl radical, which is the most reactive oxygen species. There are 4 key points that are DNA damage, protein oxidation, lipid peroxidation and cytoskeleton damage. Mechanism of cell injury by ionizing radiation. Firstly, the ionizing radiation split up the water by radiolysis into two ions. The hydroxyl ion have main role. It will act on two types of cell. They are proliferating cells and non-proliferating cells. Non-proliferating cells such as neurons and proliferative cells are like epithelium cells. In proliferative cell there is DNA damage which can result into DNA or genetic damage which result into mutations, and it can also result into inhibition of DNA replication which further result into apoptosis and cell death. The non-proliferative cell like neurons, there will be lipid peroxidation and cell membrane damage, ultimately resulting into necrosis. Thanks. Make sure to share the knowledge with your friends. Keep supporting.